Hello, I'm Ray O'Leary. I'm the Assistant Director for Missouri Breaks, and I'll be presenting on commercial tobacco use on CRST. This is going to include data from a couple different studies that surveyed community members on tobacco use from 2012 through 2022. And I want to acknowledge my colleague Bethany O'Connell, who was the leading driver behind this community report that we're able to share, and a lot of the slides that I'm sharing today. She wasn't able to join the presentation. So thank you, Bethany, for all your hard work to get us to this point. Also, we had a variety of community members that did the research collection for this study that are acknowledged here. We received funding from several different locations, and all of the information that's presented has been approved by the CRST Tribal Council, as well as all of the IRBs that we've gone through for the study. So this is a photo of myself and my 98-year-old grandmother, who is a lot of inspiration, I guess, for me. She had hoped to be a nurse and never got the opportunity. So now as a research nurse, I am very motivated to kind of fulfill the dream she never got. And also myself and my 4 children and husband on my graduation from my master's of public health in Minneapolis from the University of Minnesota. So first, kind of a little bit of background. What we know so far is that Native people in general have very high rates of commercial tobacco use, and when they're compared to other races, we actually have the highest rate of commercial tobacco use in the United States. There's a lot of reasons we won't get into today for those high rates of commercial tobacco, but it's also important to acknowledge that traditional tobacco has a role in many Native communities, and that's true for the Lakota population. So traditional tobacco, also referred to as chinchasha or red willow, is sacred and used for cultural ceremonies. It's distinctly different from commercial tobacco use because it's not addictive, it has no additives, it's not meant to be inhaled, and it's really important as researchers, as public health professionals, that we acknowledge this difference, because when we're talking about, like no smoking policies, for example, or educating kids about the dangers of tobacco, or collecting surveys from community members, if we don't acknowledge this difference, it could be easily mistaken when we say, do you use tobacco? That could have very different meanings if there's somebody that uses tobacco traditionally versus somebody who's, addicted to smoking or vaping, for example. But for the most part, the rest of this presentation and all the data that I share is related to commercial tobacco use. And then also I want to acknowledge my, the founders of the Chunli Coalition. You can see on the slide here is Randolph Runsapter, Dana Dupree, and the late Hazel Redbird and Marcella LeBeau. And they were the founding members of the Chunli Tobacco Coalition that started in 2009 and has been meeting on a regular basis for a lot of years now. We're very dedicated to this work, and it's really their shoulders that we stand on that have allowed us to be so successful in our commercial tobacco prevention efforts and policies that we've been able to do. And now I'll shift to the framework that we developed for the Chunli Coalition, and this basically is just kind of what we found worked in our community to advance tobacco prevention on Cheyenne River.
Oftentimes we would go and we'd make a little progress, and they'd say like, yeah, not yet, we're not ready to make our reservation smoke-free in indoor public places. Go back to the schools, go talk to the youth, the community's not ready. So we developed this framework to kind of describe our methods of what we found worked. And the reason we developed this is because a lot of other tribes were looking for support and saying, hey, we love this model, what can we do in our communities to do something similar? So this is what we put together. You can see that there's 2 overlapping circles. There's education and policy. And in between those is community engagement, because you can't do either successfully without an engaged community. And then we have, there's a whole toolkit basically at this link here that talks through our model and examples we absolutely want to share with everyone else that's interested in doing this. So that's what that toolkit website is for. And of course, the really important piece of this is that cultural lifeways are embedded throughout the process. We also acknowledge the arrows, so you can see that sometimes, depending on where your community's at, you just need to focus on education because you can't get on tribal council's agenda. Other times it's like, okay, they're ready for us now. Let's focus in this policy realm. So it's iterative, there's no end. We still use this actively in our community today. So kind of looking back at where the research is going now, the Cheyenne River Sioux Tribe conducted a ATS in 2005. Unfortunately, that data wasn't accessible in a way that was useful to compare for this report, so that's not included. In 2009, like I said, the Chilney Coalition formed and started working on tobacco education, policy, and community engagement. Then in 2012, Missouri Breaks did an American Indian Adult Tobacco Survey, so that's the acronym there. In 2015, and this is really where everything comes to play here, after 6 years of advocating, we were able to get Tribal Council to pass Ordinance 77, which makes all indoor public places smoke and vape free. We were the 4th in the nation to achieve this. Of course, because of tribal sovereignty, we self-govern, and tribes have to enact their own policies. We're not covered by state policies, for example, that say that indoor public places are smoke-free. And then in 2022, just recently, we did another AITS data collection point. So the interesting thing is what we're trying to find out is what changed from 2012 before the policy happened to 2022 after the policy happened. Did we see big change? Did we see any change? Did it go the wrong direction that we were hoping for? And that's kind of the whole gist of where we're going here. So methodology is very similar. Basically, it was 400 adult tribal members both years. In 2012, we had a household randomization system where we went from house to house basically and had a rhythm of every third house that we went and invited. In 2022, sorry. We did electronic randomization, and that was because this happened during COVID. Right when we were ready to go, COVID hit, and it wasn't safe for our staff to go house to house and engage in that way. So we changed a little bit of our methods then. Another thing that we changed is in 2016, we had 2012, we had a very long survey. It was 216 questions, and we did get feedback from participants saying like, whoa, that was really long, you know. So we did our best to streamline it, but there are some sacrifices when you change surveys. Unfortunately, sometimes it's not as comparable because you might ask the question, it's the same meaning, but if you ask it in a different way, it's not necessarily comparable. So we did make some sacrifices to the quality in order to relieve the burden, I guess, on participants, and we ended up with this 80-question instrument. Then sample demographics, we ended up with really similar demographics for the most part. You can see the age ranges and the average age. Gender, we had slightly more females in the more recent survey, and for education, we had slightly less opportunity for education in 2012. And the reason this matters is because we want to make sure that we're comparing apples to apples. If we have a totally different group of people in one year than the other, it's, again, difficult to compare. But for the most part, we came up with a pretty balanced sample for both of the surveys. So I'm so excited to share this because this has been like 2 years in the making, but Bethany and I just yesterday put on the finishing touches and it's ready to go and share. And one thing that I really love about this, and a reason that I really enjoy working with Bethany, is she felt really strongly about giving back to the community first. So oftentimes in research, we publish first. We go to the journals, we get things in the national domain, and then we say, okay, now how can we use this to inform our community? But we felt really strongly because this is such important information that we want to give to the community first. So that was our first priority. And then we'll move into doing like bigger publications. So I'm going to breeze through this because there's a ton. I cannot obviously go through like 26 pages in 30 minutes, but everything, all the details are in the printed packet for you. So this first slide here, it's very busy, but we're going to do our best to kind of walk through it. So what we did is we wanted to know from BRFIS, which is the Behavioral Risk Survey that all states do. It's funded by CDC. We wanted to see how our data differed from the BRFIS instrument. So all these gray bars show all American Indian people in South Dakota that took the BRFIS survey. Then if we look at the green and the blue bars here, the blue shows all South Dakotans who are white, who took the survey, and you can see their current smoking rates hover around 20 to maybe like 15% over here. And then the green line is South Dakota overall, so that's all races combined. And that's slightly higher. And the reason it's slightly higher, unfortunately, is because Native Americans in South Dakota drive that rate up slightly. So then you can see BRFIS, the orange lines here, that this is just BRFIS people who indicated they lived in Dewey or Ziba County, which is the two counties that overlap with the Cheyenne River Reservation. And you can see that in 2012, we did about 3 years, so we can get enough people to, it's a small group, but we had to basically do it that way to make sure that we're protecting confidentiality, that it ranged from 40 down to maybe about 32% here. And over here in the more recent years, it was 40 to about 32. So not a lot of change. I mean, there's some variation from year to year, but for the most part, it's about the same, around like 35 to 40%. Then we took all of the other counties in South Dakota that overlap with reservations, and that's this pink line, so South Dakota non-CRST. So we compared CRST, which is orange, to all the other tribes or counties that overlap with tribes, which is the pink. And we can see that for the most part, Cheyenne River has lower tobacco use rates than all the other tribes. The other interesting thing is ours is going down for the most part, right? And the other pinks are kind of trending up. So that's really encouraging to us that what we're doing is working. It's not drastic, you know, we're not talking about huge percentage changes, but it is trending in the direction that we had hoped for. So that's all BRFIS data so far. Again, that's state collected data. They don't have the same processes, I guess, that we do and all the hoops that we jump through to do research in a good way on Cheyenne River. And one of the things that Missouri Breaks takes a lot of pride in is our research is, for the most part, done by locals. These are people that look like our participants, they talk like our participants, they know we're all related, right? So I feel like there's maybe more honesty and more willingness to participate, and that to me means that we get a little bit better quality data than these state workers that call you up and talk to you over the phone to collect that information. So then finally the red dots here are the results of the American Indian Adult Tobacco Survey in 2012 and 2022. And it's really hard to see here, but it did go down, which we're really happy about. It was about 48% in 2002 and 47% in 2022. Again, not drastic, it's 1%, but it's going in the right direction. So we're encouraged by that. And you know, the BRFIS data does confirm that as well. So when we look at who's smoking, who are these current cigarette smokers, we can see that overall, again, there's like the 48 to 72%. All the graphs for the rest of the presentation, blue is 2012 data and orange is 2022 data. And kind of the main points, if we look for big changes, is people with a high school or GED education, there's increased quite a lot. But for the most part, a lot of the others are going in the right direction and decreasing. So this is really important for the Chilling Coalition because it helps us target our messaging. So if we're talking to, you know, if our messages are for example, 18 to 34-year-olds saying like, don't start smoking, that's not necessarily where we need to focus because that's going in the right direction. Where we need to target is the 65-year-olds and older in our messaging because they're the ones that are having the change in the wrong direction, I guess. Cigarette smoking status. So we also, this is really important because we look at if they're an everyday smoker, a someday smoker, a former smoker, or a never smoker. And we can categorize them based on how they answer different questions in the survey. And what we see here is that current everyday smoking goes down and current someday smoking goes up. But if we stack these two, that's where we get the 48% and the 47%. So what we see is more of the 47 and 48% of people who are currently using tobacco, more of them are smoking some days now and less are smoking every day. So there's a shift there of people that are probably trying to quit. They're not as reliant maybe on that nicotine. So that's also really encouraging. Then we look at people that have ever smoked a cigarette. So basically in the survey we say, have you ever smoked a cigarette, even 1 or 2 puffs? Here's our results. That data, or that change did go up overall from 74% to 87%. And this is not what we hope for, right? There's more people that are experimenting with it, but according to the past slide, maybe they're not as heavily addicted or to that stage in their addiction, since there's more people that are smoking just some days instead of every day. Vaping. So this is where it gets interesting. In 2012, vaping was brand new. It was so new that we didn't even have it in our survey yet, because we didn't really know what was to come. But we do have data from 2022 for the first time for Cheyenne River. And what we found is overall that 14.6% of our adult population is vaping here. Nationally, it's about 7%. So our rates of vaping are essentially double everybody else in the United States. And then when we look at demographic or like characteristics of participants, the one that stands out and is no surprise is the 18 to 34-year-olds that are vaping. So 36%, that's very high. So we know as a coalition, this is another area we need to work on, and it's something that we are actively working on. Lynette, one of our coalition members, is in the room here, Marcia as well, and we are actively, working at this. Just last week, we talked to all 6th graders at Cheyenne Eagle Butte and did vaping presentations. We're at all the community events doing them as well. So we're really hoping to curb this in the future years. Chewing, I'm going to kind of breeze through this. It's a lot less of a problem than the other forms of commercial tobacco. Overall, it's at 12% in 2012 and 13% in 2022. So again, it's still a problem, but it's not as big of a problem as vaping and smoking is. For quitting commercial tobacco, we also want to know, are people trying to quit? What's working for them? What methods are they using? So this first slide asks about if they've ever been advised by a doctor or other healthcare professional to quit smoking. And this is something that we also go to IHS and tribal health to talk to the providers about and encourage them that every single patient encounter, you need to ask if they're a tobacco user and ask it in the right way. Because in our community, if you just say, do you use tobacco, that might mean, yeah, I offered chinchasha this morning when I went by the river, like Dana talked about. So it's really important for our clinicians to know the difference between commercial and traditional tobacco, and that's something also that we educate them on. And not just ask if they use, but then advise them to quit. Because we know from other research done that if they say, yep, I smoke a pack a day, and there's never another comment about that, that condones their behavior. It's like, oh, well, I admitted that I smoke and they never told me that I shouldn't, so I guess it's okay, I'm gonna keep smoking. So at every single patient encounter, we're encouraging the providers to discourage their continued use. And that is something that went down. We believe probably this has to do with the COVID pandemic. People are getting less health care. A lot of times it was maybe not in person, but over the phone or virtual. So we think that's probably why those rates are going down. But it's something, again, that we can target that education with our clinicians to work on. So this looks at quit attempts within the last 12 months. And again, this was conducted in 2022, right when COVID was happening. So there's a few things about COVID coming up here. But what we can see is a huge increase, which we're really encouraged by, because there's more people that are trying to quit. We also know from research that quitting smoking often takes multiple attempts, anywhere from like 6 to 9 to 12 attempts, depending on the person and level of addiction and their motivators. So every quit attempt counts. Maybe they attempt and it doesn't work out. The goal is to get them to try again, and eventually it'll work. So we're really encouraged that we had such high rates of people that are trying to quit smoking, and the one that really stands out here is the 18 to 34-year-olds. And this is, again, all tobacco types, including vaping. So yes, we have high rates of vaping in this 18 to 34, but they also don't want to continue it. They're trying actively to quit. So that's really positive, and again, something that we can really focus on our messaging in that age range to quit. So then when we look at secondhand smoke, we asked the percent who believe that secondhand smoke is harmful. And again, really positive. For the most part, almost all participants say, yep, I know it's harmful. It's at 96% in 2012 and 97.8% in 2022, so it did go up. We like that. So it's not, this is maybe not the message that we need to really push, that secondhand smoke is harmful, because for the most part people know this. We need to talk about methods to reduce their exposure to secondhand smoke maybe, and kind of fine tune those, that messaging. And when we look, education does matter. Those who had less formal education had less rates of that knowledge versus college graduate and higher, which is 100%. So that kind of does help us figure out who we need to target that message to. So when we look at rules in homes, and just in the previous session there was some good information from our colleague Anna Tillery at Johns Hopkins about smoking rules in homes. But again, we're going in the right direction. In 2012, there was 66% that said that they had a rule against smoking in their home, and in 2022 that went up to 75%. This doesn't necessarily mean that just because they have a rule that their home is smoke-free. It means that the person who says they took the survey and asked, do you allow smoking in your home, said no. But then interestingly, we had a lot of people that would answer, how many days are you exposed to smoke in your home in the last 7 days? They would say maybe 1 or 2. So when those surveys were coming in, that's something that we caught, and we'd ask them and say, okay, so you say you have a smoke-free rule, but you're exposed. And they say, well, not everybody follows it. Like, yeah, I have a rule, I have signs up, I talk to them about it, but the grandkids smoke. Or when grandpa comes over, he gets to smoke because we don't tell grandpa that he shouldn't, right? Because that's he's our elder and we want to respect that. So that's something that we're encouraged by, that there's more people that are not allowing it, but again, getting that people to follow it is a little bit of a different story. And now this is the big one because of the policy. So remember we talked about in 2015, Cheyenne River enacted a policy, Ordinance 77, to make all indoor public places smoke and vape free. So before the policy happened, about 88% of the people said they were not exposed to secondhand smoke in their workplace. And now it's up to 95. So we're really encouraged by that. Overwhelmingly, for those that are not from the community, when you drive around town, watch the windows of the businesses. Most of them have either a big yellow sign that says no smoking within 50 feet of the building, or this is a smoke-free establishment. The Chunley Coalition has been big pushers of getting these signs out in the community. We know that the policy can only be as strong as the community behind it. So if there's not good enforcement with signs, if people aren't educated that this policy even exists, it's not going to do anything. So we've really worked hard to send out reminders to all the tribal businesses, to any business list that we can find from four bands, for example. Every year they get a letter from the chairman saying, hey, just a reminder, like, we're still smoke-free and here's all the rules that you need to follow and consequences if you don't follow it. To date, I'm not aware of any violations that have been given out from law enforcement. And honestly, we're okay with that. Like, it's part of the policy. Yep, law enforcement can give that. We don't want to be, crazy about this, but to have 95% of the people following the rule and protected from smoke secondhand smoke in their workplaces is incredible. So we're really happy about that change. And I think, again, the one to look at here is 65 plus. This question was only asked of people who work indoors. So like a construction worker didn't even see this question. Somebody who's retired at home didn't even see this question. But of our 65-year-olds that are still working, there's still, some issues with smoking at the workplace. So moving on to COVID. Ooh, I'm not sure. We're gonna fly through this, guys. So COVID's pandemic impact on smoking. We did have a couple questions that just said, you know, how did the COVID pandemic impact your smoking? And we found that what we have here is for smoking, and on this side it's vaping e-cigarettes. It's a mixed bag. Some people smoke more, some people smoke less. Some people started smoking during the pandemic and they cited stress for the most part. Some people stopped smoking during the pandemic and they said, well, I'm afraid that I'm going to get COVID and my smoking is going to make it worse, because there's a lot of education on that. And some people said there was no change. So it's kind of all over the board, both for smoking and vaping. And this is really consistent with what we see in the national studies, that it's a mixed bag. It had a positive impact on some and a negative impact on some. I'm going to skip that one, but we also asked qualitative data, and we just said, do you have anything you'd like to share about how COVID impacted smoking or vaping within your family and friends? And here's a couple of quotes that are kind of interesting. So here we have, among those who had tobacco use increase, some said, I use more cigarettes. I think COVID made it worse. And then some of them said, I didn't increase my tobacco use personally, but I observed others in my circle who did that. I think being on lockdown and staying home for safety reasons did increase tobacco use at residential places. People were stressed, and I'm assuming some smoked more than usual to cope with the additional stress COVID-19 brought. And then similar quotes for those who started tobacco use. Like somebody who said, yes, I actually quit before the pandemic, and after I lost my mom, I started smoking and vaping. I'm still smoking and vaping. So again, that stress factor, right? That it was a really stressful time, not only on like, is my job secure? Is my income secure? But the health impacts of themselves and the people that they love from COVID. Here, some people said that they had an increase in secondhand smoke exposure because of COVID. They were at home more, and maybe that's a smoky environment. And then this is just some quotes on why they saw those negative changes. But again, quotes on the other side is of positive changes. When I got COVID, it really messed with my lungs and breathing, so my smoking decreased. My lungs burn sometimes now. Quit tobacco. COVID-19 had a big impact on me because of my age. It scared me, so I quit. So there's some really positive examples of what COVID did to tobacco use, but again, it's a mixed bag. So, I think I made it just a few minutes over. This is Bethany and myself at the National Tribal Tobacco Conference that we got to present at this last spring. And yeah, if there's any questions, I won't take any more of the next presenter's time. We'll just follow up after the sessions. Thank you all.